Eastern Cape schools have been hit by a worrying COVID-19 wave this month. The Provincial Education Department says over 2,000 pupils have been infected. That's since the start of August, and at least one of them is known to have died. Teachers are also testing positive, with close to 160 cases confirmed among staff. The infections are said to be spread across 308 schools. We can now speak to Ms. Naledi Mbute, who is the HOD for the Department of Education in the Eastern Cape. Grateful for your time, ma'am. Thank you for being on Newzroom Afrika. Can we begin with what it is that is driving this number of infections at schools in the Eastern Cape? Let's get an update then with Dr. Naledi Mbute, who is the HOD in the Department of Education in the Eastern Cape. Doctor, I hope you can hear me better now. Can we begin with what you believe is driving this high number of infections in your schools?
The most important, thank you very much. The most important reason is the fact that the non-pharmaceutical interventions like social distancing, always wearing masks and keeping distance and washing hands, we find that with the age group, the age cohort that's now involved, they are not really attending to that part. You will know that with the lockdowns, usually students are sitting at home, and now that they have to go back to school, they are not really attending to the NPIs that everybody must account to. So we are having a problem because most of what is happening right now is what is happening generally in society, where people have NPI fatigue. We are beginning to see that when schools opened, everybody attended to them, and now that there is fatigue in the system, you find that they relax those rules, which is why we have gone back to train our principals, our SGBs, and everybody in the school community, because NPI fatigue is setting in.
And are you seeing the bulk of the issue in primary or high schools?
It is mainly high schools that are posing a challenge, because young people are communicable. They want to chat with one another during break, and sometimes they get fatigued easily as well.
One of the reports I was reading said that about 72 schools had at some point in the Eastern Cape had to stop lessons because of outbreaks. What is the update on schools that are not operating as a result of infections?
I think it is normal for parents to, every time that there's a report or there's testing happening, for SGBs to want to close schools. We've since corrected that, because with the science that informs the Delta variant of COVID-19, we know that 9 hours is the time that it should be able to last in the surfaces and in the environment. So we've since communicated that there is no need to open and close schools intermittently or sporadically. Schools are only closed for that 9 hours so that they can be deep cleaning the surfaces. So the number has reduced drastically, because between the department officials of education and health, we've said that it's important to note that particularly our exit grades, grade 11 and 12, we have very few time that's left for them to concentrate and to get them to be on the same level with other provinces. So the sporadic opening and closing of schools in the Eastern Cape is something that we've dealt with.
And it's extremely worrying, because the Eastern Cape is another of the provinces in this country that have vast areas which are rural, where people don't necessarily, for example, have the resources to connect virtually for a lesson.
Yes. Yes. Hence, we had started last year the project of rolling out the IT tablets, so that we could get to the areas where children did not have access to schooling last year. So we are embarking on a similar project for 2021 as well.
Just on that question, the note about rural schools, when you look at these infections that you're dealing with now, are they concentrated in the urban or more rural areas?
Right now, it is our urban areas, because of the volumes of people who are in and out, like your Nelson Mandela Bay, your Sarah Batman. There are rural areas in Sarah Batman, your Chris Hani and Joka, the latest now, because particularly in areas or in areas where people congregate and work there. But we do not find these in our deep rural areas, where people don't often move out and out-migrate to go to work on a daily basis. So we find this in mostly our urban areas, particularly in our township-like areas, where people go to work and come back in the afternoon as well.
And the Eastern Cape is one of those provinces in the country where you've had to close some schools due to low pupil enrollment numbers. What is your assessment of the situation as far as classroom volumes for children, especially in light of the conversations that we're having now about what to do about the social distancing requirements in class, whether to reduce that or not?
Fortunately, this has worked to our advantage because the Eastern Cape has about 4,000 classrooms that are extra in terms of the learner numbers. And we've just gazetted 1,142 schools where the numbers are rendering the schools unviable. So because of that, the Eastern Cape, therefore, has that advantage because we had classrooms with less kids. But there are areas where there is over-concentration, primarily because of the academic performance of the school or the resources that the school has. But in total, we have a strategy called decanting, where in an area where the school is overpopulated, we decant to a school where there are classrooms that are empty, because we are sitting with a surplus of empty classrooms because of the closing of schools in the province, because learners are going to other provinces. But our numbers have risen this year. It's 1.8 million. Therefore, we are seeing the steady rise of numbers. But our issue has been over-concentration in particular schools. We've seen this with our independent schools as well. Therefore, rendering us in making sure that we go back to say, we need to train you, to retrain you on the standard operating procedures. We need to retrain you on the NPIs, particularly our hostels, where they over-admit learners because of the need, particularly in also our independent schools. So both independent and public schools in the province have had the series of training so that we can try to contain the spread of the Delta variant.
And a challenge that I would see you as government having to deal with in this space is that it's all good and well that you are working to train educators and pupils and other school staff to adhere to the non-pharmaceutical interventions, but you're also dealing with a section of the population, the children, largely, if not completely, unvaccinated in schools. These are also teenagers and younger children who go to families that may not on the weekends be masking up and staying home and are in fact mixing with other people and bringing cases into schools.
Definitely. I mean, we see over the weekends the sports that is playing out in fields because of the relaxation of the alert level 4 now. We see many people, even in our malls and in our shopping centers and in shops, unmasking as well. This has a direct impact in terms of the number of infections in our schools because they go to a closed environment. Schools, by nature, are supposed to be a closed environment. So the infections would spread because they spend about 7 hours there. And this is exactly very true, that they bring it into the environment and then everybody else gets infected. So our communication strategy has been that we go on radio, we do our Facebook, we have our own Facebook page, where we continue with advocacy, particularly in the languages of everyone in the province. We have 4 official languages in the province, so that we can reach, our advocates can reach. We also work very closely with the Department of Health on this one. Each school in the province is linked to a health professional, so that when there is a case of a suspicion, whether it's symptomatic or asymptomatic, that school does not have to go and sit in a clinic and infect other people maybe who are there for other comorbidities. So that health official will go straight into the school so that we limit the number of people who go to clinics and possibly infect other people as well.
Dr. Naledi Mbute, good to speak to you so much. The doctor is the HOD in the Eastern Cape Education Department, updating us on the COVID-19 outbreak at schools in the province. Thank you for your time, ma'am.